This is Chapter 1, Caring for Medical Surgical Patients. There are 3 consecutive slides that cover the learning objectives for this chapter. I will pause for each one of them, and you can read them on your own. You may need to stop or pause my recording. When we care for our patients on a medical surgical floor, as safety is our first priority, we as nurses also want to promote good health aspects, and we assist the patients to maintain their current level of health and not decline. We work on preventing any disease processes, and we also assist with disabilities. Nurses will assist in the rehab process, whether it is ambulating a patient on a floor or maybe you work at a facility that's a rehabilitation facility. We help individuals cope with death and dying and grieving, and nurses use the nursing process to plan care, deliver the care, and make sure that it's competent. The nursing process encompasses the acronym ADPIE, A-D-P-I-E. A is assessment, P is planning, D is diagnosis, I is implementation, and E is evaluation. What will your role be as a licensed practical nurse in the state wherever you reside? Every state has their own Nurse Practice Act, and it helps determine what any nurse is allowed to do within the state's confinements or its given territories. We know that we are to maintain our competency within our clinical practice. As I stated, safety is always our priority. We always educate patients. We want to make sure that they know how to continue their rehab at home, that they understand about their medications. We want to make sure that we're using good communication skills, always asking open-ended questions to gain as much knowledge related to the patient as possible. Nurses are collaborators. We all work together as a team. And as a nurse, I always put my patient's needs first. All nurses are taught to be leaders or delegators of patient care. We want to make sure that we understand the Nurse Practice Act of the state where we work. We have to know what we are permitted by law to get, what task we may give or delegate to someone, and we need to know that what the Nurse Practice Act states related to the unlicensed personnel's standards. So if you're going to delegate something to a UAP or an unlicensed assistive personnel, something as a nurse that we can ask them to do is to take a set of vital signs. We can ask them to ambulate. We know that being a charge nurse, we oftentimes have to delegate. A practical nurse can become a charge nurse. They can be a charge nurse in an institution of a unit that has units. Think about long-term extended care facilities. There may be one registered nurse that works in the facility, but each unit needs to be managed by a nurse. So yes, a charge nurse can be, an LPN may be a charge nurse, depending on the institution. When delegating any task to any other nurse or an unlicensed assisted personnel, we need to look at right task. Is that something that that individual can do for a specific patient? We look at the circumstances. I want to make sure the patient is stable, and I'm using my own clinical judgment to determine whether or not the UAP or the other practical nurse can handle the task that is being given to them. Do they know how to work the equipment necessary? I want to make sure that when I choose an individual, that person is competent to do what I'm asking, and I also want to make sure that they're qualified and knowledgeable. If I'm giving something to a UAP, I need to make sure that I give them good direction and communication. I'm going to tell them exactly what I want done, how I want it done, and when I need to have it accomplished by. We also look at supervision. So as a charge nurse, it is our responsibility to monitor that patient, make sure that that task gets accomplished. We'll go in and assist or intervene if the patient safety is in question. Okay? At the end, we want to make sure that we're actually evaluating and letting that individual know that they have done a good job for us and we appreciate it, or hey, there's a few things I noticed that might make your job easier, and help them out. There are many employment opportunities for practical nurses. Hospital settings are using practical nurses in outpatient surgery centers, sometimes in step-down units. Practical nurses, if they are certified, they can work on the IV therapy team, and they can work in the emergency department. Practical nurses have very good nursing skill set, so they're very useful in managing patient care. Long-term care facilities, nursing homes, that's one area that is heavily employed with practical nurses. You also look at ambulatory care. That's an area that a practical nurse would excel at. Rehab, hospice. Many practical nurses will work for hospice. In a group home, maybe in an assisted living facility. Oftentimes they will have a nursing unit, but it's going to cover so many different apartment type dwellings. Homes for people that are developmentally disabled, home health. Usually a nurse can be a charge nurse for a home health agency, private doctor's offices, obviously the military. A lot of practical nurses will work in kidney centers, dialysis centers, and then we also need nursing in jails and prisons to work in the ward in case anyone gets sick or they happen to need a vaccine. So what should you, the nurse, consider before delegating a task? This is a select all that apply. Number 1, know the scope of practice. Number 2, be aware of the staff competency and experience. Number 3, seek approval from the administration. Or number 4, determine the stability of the patient condition. So your answers are 1, 2, and 4. Each state of the United States has their own Nurse Practice Act. This explains to each form of nurses what their actual scope of practice is. So what are we allowed to do legally? Because there are legal ramifications to our jobs as nurses. And for us to be competent in what we do is, 1, we want to make sure that we're prudent and do as a perfect nurse would do. That's the way I look at it in my eyes. Ethical practice. So ethical means that we are going to put our patients first. Okay, so we're patient-centered. We are very respectful. We care about their culture. We show our compassion and our caring. So we're working on safety at all times. That's why we have national patient safety goals. And we know that HIPAA is a federal mandate that all nursing personnel needs to follow, and that is keeping the patient's information confidential, and it is on a need-to-know basis. So quality and safety education for nurses, or QSEN, it's an organization that has standards that we as nurses need to follow to provide competent and safe care to our patients. I explained what patient-centered care means, and that the patient is always first. The patient is always a partner in their own medical care. Our care is always teamwork coordinated, and we work together to deliver the appropriate care to the patient that we're taking care of. We know that a charge nurse or a care manager can be different individuals within a hospital system. Nursing researchers use science, and they will do research to make sure that our practice has the best evidence base. So we as nurses, our sole nursing practice is based off of science. There is always a reason that nurses make the decisions that we do. We know we need to think about the patient's circumstances and their specific preferences. And we are always looking for scientific evidence whenever we are providing care to our patient to make sure that we are giving the patient the best care possible. 5 steps in developing evidence-based practice would be your use of science to ensure that we are doing it appropriately and correctly to get the evidence that we need. Quality improvement is one aspect of nursing. We're always making sure that we are looking at what we do. We evaluate what we do. We want to make sure that we are providing the best possible care for our patients. We follow specific standards of care. Standards for us are from the American Nurses Association, the Joint Commission that accreditates hospitals. Informatics for nursing is still in its infancy stage, but what it is the use of technology and patient information to be able to manage patient care and communicate between institutions, allows us to decrease the amount of errors that we make, and the data that is received from informatics helps us to make decisions related to informatics. The health EMR or EHR, that is the driving force behind the branch of nursing for informatics. For an institution or anyone to communicate patient care back and forth, the device used, whether it's a cell phone, a tablet, a laptop, it has to be approved by the facility because they want to make sure that there is safe data transfer. So safety is our highest priority when we're taking care of our patients. So every nurse needs to think about providing safe actions during every interaction that we have with our patients. The Joint Commission for Hospitals has made several suggestions to help improve, for example, handoff communication, which is using the SBAR. This has been identified as a point where there's miscommunication that can cause patient harm. Today's healthcare considers something like biomedicine. And what this field of study does is to figure out the actual root cause of a disease process, and then it wants to totally eliminate or fix the problem. As I'm sure you remember, this is medical thought process, okay? Disease process, correcting the disease process. That's the way the doctor thinks. Patients now use complementary and alternative medicines. Complementary means that it goes along with the current prescription, the treatment prescription. Alternative means that you're doing something in place of what the physician or the doctor would have determined to do. When you look at medical care today, it's extremely costly. We as nurses have to be mindful of the money that we spend and the wastefulness that we do if we're not coherent of what supplies we're gathering and how much supplies we're using. We should use as much as necessary, but not overuse, because our patients, they have to pay for these. And I don't want to cause my patient any ill effects. So spending their money unwisely is causing my patient ill effects. So Healthy People 2020. This is something put out nationally. It is talks about health promotion and disease prevention. It is a specific plan to improve American health during the first decade of this 21st century. This will include health objectives that are based on science, and it has the potential to affect all Americans and help decrease the cost of healthcare. When we're discussing how healthcare is financed, it can be very confusing. So if you're a full-time employee, you can routinely obtain private health insurance through the employer. People that are of working age and who are healthy and continue full-time employment, they're not the actual biggest consumers of healthcare dollars. People that retire and that have chronic health problems and young people that cannot work, they're the ones that use more of the health insurance than people that are of working age. So we know that Medicare and Medicaid in 1965, they were created to help cover the needs of these different groups of people. So traditional method of financing for healthcare is fee-for-service. So this is usually a direct reimbursement from the insurance company to the healthcare provider, and then as long as the individual is covered by a health insurance plan. So we do try to improve the coverage costs. Insurance providers usually charge a deductible, and once that amount is met for the person that has insurance, then the insurance provider will usually begin to pay for services. As far as a copay, usually that's the amount of money that somebody must pay when they go to the office or maybe pick up a prescription. And then coinsurance is once the individual meets the deductible, the percentage of the bill is paid that would usually go to the consumer. So what the insurance company does is subtract the amount that the patient actually would pay on the bill, and then the insurance company will give the rest to the healthcare provider, and the patient will get a bill from the healthcare provider. So, two that are important for us to understand as medical people, nurses, is that Medicare, right, that is care to the elderly or care to individuals that are older than 65 years old and their spouses. But these individuals had to have at least a 10-year record of employment. And they also have to be citizens of the United States. Now, if somebody is on disability, permanent or totally disabled, Medicare will be given to people that are younger than 65 if they have like end-stage kidney disease or, as I said, disabled. People that are eligible because of their age, then you have to be 65 to get on Medicare. Medicaid, the way I remember it, is aid to individuals. So this is funded both by the federal government and our state's governments. This provides insurance for families and individuals that have low income and very few resources. So in Medicare, the federal government controls the finances. In Medicaid, the state controls the finances, the Medicaid program, and determines who and who is not eligible for aid. So as a nurse, we're concerned with the whole person. Okay, I am, as a nurse, not just looking at their issue for the day. Okay, so somebody, let's say somebody comes in and they're a type 2 diabetic and they came in because their sugar was too high. All right, that's an issue for me, but then there's other things that I have to consider as well. I need to think about the different, the physiologic, the psychologic, social, cultural, and spiritual aspects of that person. So when you're thinking physiologic, those are basic needs: air, water, food, shelter. Okay, psychological, that is mental. Social is where they live, who they interact with. Cultural is their sense of person, their sense of being. And spiritual, what do they believe beyond this planet? Most individuals believe in some other form of being. Okay, but what does your patient believe in? All nurses have to have a nurse-patient relationship. It is a rapport that we have with our patients. So it's key that we as nurses are able to be trustworthy with every encounter that we have with our patients. So for example, if you're going to need to leave for a minute and you were going to do something with your patient and you tell your patient you will be back in 10 minutes, you need to be back in 10 minutes. Okay, that establishes a trust relationship with that patient. Empathy means that you're able to understand how that individual feels. Therapeutic communication is using open-ended question. And that's how we get the most information, is not asking those yes or no, which are close-ended questions. We need to ask questions that engage our patients in conversation, right? We want to make sure that the person is able to still feel good about themselves, even though they're in a medical facility, right? We are always concerned about pain aspects. Anytime somebody comes in, that is right on our admission checklist. So we're always asking people what the pain level is. How are you feeling today? All right, if something happens, we need to be extremely compassionate. And we need to make sure that we understand the use of touch. and get an understanding of the patient and their culture before we lay hands on someone. Which statement would indicate therapeutic nurse-patient relationships? And of course, it's select all that apply. Number 1, you poor thing, I had a similar surgery. Number 2, you seem upset about your procedure. Number 3, what do you mean when you say that? Number 4, you will be fine. And number 5, may I hold your hand? So which of those 5 would you select for this question? The answer is number 2, 3, and 5. So to meet someone else's cultural needs, we as nurses need to understand our own judgments, our own biases, and see if we have any stereotypes. Because as a nurse, I need to set my thought process like that aside. Okay, because this is not about me. My healthcare is related to my patients. So I need to know how can I best serve my patient. So nurses need to not be judging. All right, and everybody has differences. We just need to be accepting of the individuals that we're caring for, and everyone always receives the best quality care that we can offer. So we are now recognizing cultural diversity, and we are attempting to deliver care that is sensitive to people's cultural needs. So do you happen to believe in the art of prayer? Maybe a prayer chain, a prayer circle? Many people find that they rely on their spiritual beliefs in a time of a medical situation. So we as nurses need to provide for spiritual care for our patients and their families, because we understand that if the patients in the hospital may experience pain or a disease or illness, or goodness sakes, even a death, that we need to help care for that patient and help them cope and make it through the situation that they are currently facing.